Hello everyone, this is Dr. Brian Campbell. I wanted to take a few moments to talk to you about integrated Christian counseling. You're going to be learning about that in this course, and I wanted to take a few moments to show you what it actually looks like before you start the course so you can see what we're going to be learning about and actually see it in the flesh, so to speak, in terms of how to do this. The first book you're going to be reading is Entwistle's textbook, and that deals a lot with theology and philosophy, and basically theology and psychology eventually emerged, and how the two sort of struggled together to try to merge. And then the concept, the overriding concept, is truth, that all truths are God's truths, and that that's what we can utilize in terms of understanding the knowledge of the body and the mind. That's true. That's God's truth, and theology is God's truth. So we have two books, the Book of Word and God's Word, and the Book of Life, and we can integrate those. So I want to tell you quickly how I do that. I was trained in a lot of different disciplines experimentally. I was trained in psychoanalysis. I was trained in cognitive behavioral therapy. I was trained in behavior modification. And one of the things that emerged not so long ago, well, actually 20 years ago or so, 25 years ago, was the whole field of cognitive behavioral therapy. And that technique has been shown to be efficacious for all the different types of treatments of disorders. If you look through the literature, you're going to find cognitive behavioral therapy everywhere, because it seems to be the most powerful and the most useful type of therapy. So I decided to extend that and utilize my Christian faith and my Christian principles, and I extended on the basis of the cognitive therapy, the thinking. I believe, and cognitive therapy works on this premise, that the way we think affects our behavior, emotions, etc. So I want to try to extend that cognitive therapy into the realm of Christianity. So I use the truths of Christianity to come to bear upon the irrational beliefs or the cognitions that people are having that aren't true, that cause them mental health problems. In fact, almost a majority of mental health problems are caused by, in my opinion, irrational beliefs that need to be changed and dealt with. So I utilize that. I also utilize my knowledge of the body, of the brain, of relaxation techniques, of the autonomic nervous system, etc. And I'm going to talk to you a little bit about that. So I incorporate that knowledge into my Christian counseling. And the marriage is really good, and it works very well if you have all those different types of training. And so I have a lot of tools in my pocket that I can utilize, but I also keep very much a Christian perspective on this when I'm dealing with Christians. So what does that look like? Well, I have a private practice, and the first thing that happens is we have people call the office who have problems. Now, the initial intake, my wife does. She's been trained to do this, and she screens. So I don't take everyone who comes into Christian counseling. I don't take, for example, cases that have to do with child custody, have to do with divorce, etc. Usually I don't take those because there's going to be litigation involved, and in fact, in child custody cases, I'm not actually permitted to evaluate those cases, because in Florida and many other states we need to utilize forensic psychologists when we're doing that type of evaluation. And they're people who are trained to give a broad evaluation and try to really understand what's going on. So it's not appropriate for just a psychologist to do that and make recommendations, so I avoid those. I don't treat people who have addictions. I don't treat people with alcoholism in the outpatient setting, because very often they need to be treated with specialized treatments, sometimes inpatient, sometimes specialists. In Florida, we have certified addiction specialists. By the way, we also have the master's level people too, practicing mental health counselors, and marital and family therapists are also licensed in Florida. So those are the master's level people licensed. And so I'm a little bit different, and now I have other types of rules that I have to follow as a psychologist. But anyway, so we have the initial intake, and sometimes that involves spiritual issues that you can see right away. Sometimes it doesn't. Sometimes it's not clear what's going on. My wife screens as much as she can, and then I look at it and I decide whether or not we're going to take the client or not. And what she does after that, then she sends out a packet, or usually email, of an adult history, client history, my client handbook, which discusses confidentiality, etc., and how I practice. Those are very important tools, and they're legally required. I'm also under the rules of HIPAA, so I have to follow all those rules in terms of having locked cabinets and various other things that HIPAA requires. So we send out that information, and the client fills that out, so we can expediently get all that information collected. And that information is extremely important. The background, the adult history, is going to contain information, for example, on medications, on prior hospitalizations, on background. It also includes information on current symptoms that they're having, so I don't have to go through all those symptoms. I can look and sort of screen those symptoms. It has questions regarding their spiritual life. It has questions regarding their upbringing, their parents, and the influence that they've had on them. So I get a broad spectrum of information. And this allows me to look at the person from different levels of analysis, which is I can look at them biologically, I can look at them from family systems, etc., and I can conceptualize what might be going on using those multiple sources of input. And sometimes there are complex things going on. But during that process, I'm also listening for what beliefs did this person buy into, what irrational beliefs are sort of binding them. And that's a theme that goes through my counseling, is the irrational beliefs. I'm going to be focusing on those. Now, I actually put on my internet site, I have a presentation called Take Captive Every Thought, which describes Christian cognitive behavioral therapy. So in the counseling, I utilize my knowledge of psychology, my knowledge of the brain, the body, my knowledge of medications. When all those things are interacting with my knowledge of faith and Christ and the truths that are there. And I often utilize those truths to help defeat irrational beliefs that people might come into the counseling with. Now, after the first session, I've sort of figured things out a little bit, but I still don't usually have a differential diagnosis. I need to get a diagnosis so that I understand some of the broader concepts, some of the broader things that might be going on with the person that I need to deal with. So I use a general instrument called the Milan Clinical Multi-Axis Inventory. And that inventory is sort of like doing blood work, but psychological. And it allows me, it has graphs and allows me to see where the person is in terms of anxiety, depression. It's all standardized. It's a very sophisticated instrument, and I utilize that a lot to do the blood work, sort of, the background, so I don't miss anything. Very often there are underlying Axis 2 personality disorders, for example, that may be very important to understand if I'm trying to help this person or treat this person. And those Axis 2 disorders also have connected with them irrational beliefs, so I can also focus on those from that perspective of irrational beliefs and helping people change those and come to a knowledge of the truth, and the truth sets you free. All right? That's where my faith comes in. So the next session, I have the person take the test, and then I work on that differential diagnosis more. I ask more questions. I ask about their spiritual history. I ask about their background. Anything that I think might be influenced in the current symptomatology that I'm seeing. I'm trying to arrive at a differential diagnosis. So I want to talk to you quickly about I give you a case study. I had one woman, I'll call her Mary. She's a Christian. She came in and was saying she had panic attacks, anxiety, strange thoughts about her husband in terms of killing him and doing things to him, and they were very upsetting to her, just having the thoughts. She also seemed to be anxious in general, and as I said, she had panic attacks. She also had chronic fatigue syndrome. She had burnt out her system because of adrenaline. And so there were a lot of things I needed to look at. She had medication, which was important because many clients need to start out on medication. Hopefully we can get rid of it, but sometimes medication is crucial to the person's therapy and crucial to helping the person. So you need to understand that and not just like throw that out because it's not, quote, spiritual or whatever. This is the integration, the flesh, the body with the spirit. And I'll tell you a little bit more about that. So the diagnosis for this particular woman came out to be very complex. Here was the diagnosis. So, Axis 1, she had attention deficit hyperactivity disorder as well, just to add that into the whole mix. She had generalized anxiety disorder, panic disorder without agoraphobia. She had dependent personality disorder and obsessive compulsive personality disorder. So we had a lot going on there. Now, as I'm conceptualizing this, I'm conceptualizing the body, the flesh. That's the psychology part of it, if you may. That's the scientific part of that. Those are the truths there. And I'm also looking at the irrational beliefs, the belief system that she built up, and trying to sort of analyze that as well. Well, it turns out her mother suffered from anxiety. So very often the toxic beliefs that are taught by parents are extremely important in understanding the presentation of anxiety disorders that we get. Same thing with depression. So her mother basically taught her the underlying belief was the world's a scary place. So she grew up with that irrational belief. Now, of course, that flies in the face of God or faith and the truths there and how we can nestle under His wings and how we can trust in the Lord. And so she needed to sort of remember those truths. So I helped her, spiritually with that part to defeat the irrational belief that the world's a scary place. But I also incorporated a very interesting technique that I want to show you that comes right out of psychology, and we integrate that with theology to show you the integration. I use a technique called cue-controlled relaxation, and that involves a prompting device. Actually, I have my iPhone, and on my iPhone I have it set for every 7 minutes it goes bzz, bzz, and it buzzes, and then when it goes off, I go, "Thy will be done." Basically, what I'm doing in that, the slow deep breathing helps turn off my nervous system. This is the flesh part, all right? And then the cognitive restructuring is turning things over to the Lord. Sometimes I go, let go, and let God. Now, the effects of breathing are very powerful, and you can see this with gurus who, they don't know God, but boy, they know how to breathe, and that helps shut off their physiology. So I'm dealing with the flesh part by helping her learn how to do slow deep breathing and to relax, but I'm also combining that with a cognitive restructuring using Christian principles. For me, when I got broken at age 40 and was born again, it was getting down on my knees and turning over to God and saying, "Thy will be done," and this peace that rushed in that transcended all understanding. So what I want to help people do is unprogram or decondition to the faulty beliefs that they bought into. And she bought into that major belief that the world's a scary place, which runs contrary to what we know from the Bible and the truths there. So, do I pray in counseling? Yes. And once again, I have that in the initial admissions and the consent forms. They know that I'm a Christian. They don't have to opt for that, but I normally do. I normally pray at the end of the session rather than the beginning, and I'll be talking about that to you in prayer. Do I use scriptures? Yes, I use scriptures. I have verses, and I have a book that I wrote that I utilize to help find scriptures so that I can utilize specific scriptures to help defeat the irrational beliefs. I'm always conceptualizing those irrational beliefs because they really underlie most of the problems that you're going to be seeing. So that's what you should be doing too, conceptualizing what are those irrational beliefs? What have they bought into? For depression, for example, their irrational belief might be taught to them that there's no hope, the world's bad, everyone's out to get, that there's no hope out there. And of course we know from God that there is hope, and and that we can always turn to Him. So that's the truth that's going to fight against the irrational beliefs that they bought into as they were going along. So I spend a lot of time doing that. I give homework a lot too. I have on my internet site, I have a library of Christian counseling books, and very often I'm recommending those. I give chapters out of my books for people to read that have to do with scriptures that help them understand. But I also teach them about the body. I teach them about the flesh. I teach them about the autonomic nervous system. I teach them about panic attacks. I give them that knowledge about their body so they're not so frightened. In fact, 70% of treating anxiety disorders is just helping people understand it's just your nervous system. It's just your amygdala doing this, and we can tame it and we can relax it through techniques such as breathing techniques, and they help reduce the anxiety so that people can even benefit more from Christian counseling, benefit more from the truth once we get the flesh sort of taken care of. So I hope you can see the integration in the way that I do that. And I use scriptures, I use prayer. I pray for them all the time, as we're going along. Sometimes explicitly, sometimes implicitly, but I'm praying a lot. I'm praying for myself. I think I tell you in one of my videos, I get plugged in the morning so I'm ready spiritually to deal with problems because they can be pretty difficult. So I'm sitting here, hopefully, being a testimony to God too. I mean, deep down, I ask for God to guide and direct me as I'm doing counseling so that I can have insights. Very often I feel like I'm a conduit for God, and I'm not actually doing this myself, that God is involved so much in what I'm doing and I allow Him to speak through me and to speak to others. And so I have a lot of responsibility to be Christ-like as much as I can too, so that they see God's love and they see in me. And that building of trust and building of relationship is tremendously important in counseling. So I utilize a lot of different techniques, a lot of different knowledge from psychology, from different perspectives, from behavior modification, etc. In fact, sometimes I just do strict behavior modification and don't involve Christian principles whatsoever. For example, if a child has anxiety disorder or actually tantrums or eating problems, or I do a lot of parenting stuff that doesn't really need to be couched from a Christian perspective. I just understand behavior modification, and I can teach people how to utilize that. Very often, the child's not the problem, by the way, it's the parent, and I need to teach them how to parent. But I also use the scriptures in that. I mean, I have a chapter on parenting, and I tell people the importance of disciplining their children from a biblical perspective. So that's how the two tie in there, too. So sometimes, even though I'm doing straight behavior modification, I tie it in, especially with my Christian parents, on why we need to discipline our children. And God loves those who, discipline is an act of love, actually. So anyway, that's another illustration of the integration. So I'm always trying to utilize the best of psychology and the best of my theology, and growing all the time. I'm not a theological expert, so I have to pray for God for wisdom and guidance myself to get more knowledge to be able to bring that to people. So I hope you understand and can see an illustration there of the integration of those two. And I spend my life actually helping people identify, challenge, and replace irrational beliefs with biblical truths, and hopefully, and I know that the truth will set them free if I can get them to the truth and to stay there long enough. So that's just an example of the whole process of Christian counseling, and I wanted to show you that before we actually get into learning about different components of that. God bless.